Right, one more time. It is recording.
Mak kenapa tak sama je kat Google tu? Dah alang OBS tu dah record ni tadi.
Tak pastilah. Okay, lagi sekali. Apa nama? Aina.
Oh, nama aku kau lupa
Lupa nama.
Okay. From the top. Aku buat ringkas je.
Alright.
Okay, 1, 2, 3. Assalamualaikum warahmatullahi wabarakatuh and a very good morning everyone. My name is Nur Aina Wahida bin Ahmad. Me and my group 8, would like to present about cerebral palsy. Next slide please. Next slide please. Oh no. Aku terus. Alright. What is cerebral palsy? When we not know about one of the group of disorders that affect a person's ability to move, maintain balance, and posture. The cerebral palsy disorder is the most common motor disability in early childhood, and it's caused by damage that occurs to the main immature developing brain that most often before birth. Basically, this happens a lot during birth when the baby is in the mother's womb, and or maybe right after they got birth. I guess that's all from me now. I shall move on to my friend next, Amar. He will be explained more about cerebral palsy with more detail.
Alright, good evening. Salam sejahtera, salam satu Malaysia. Alright, I'm gonna explain cerebral palsy in detail. Just origin. I'm gonna start with when does people found cerebral palsy. Cerebral palsy has affected humans since the age of antiquity or the ancient time. All this physical evidence from the mummy of Sita, an Egyptian pharaoh. And the first description of cerebral palsy is from the Greek philosopher Hippocrates in the 5th century. And cerebral palsy first named cerebral palsy from the German word cerebral Lahmung. And from the English, they begin studying cerebral palsy in the 19th century by the name of William John Little. Thank you. That's all for me.
So hi everyone, good morning. I will be talking about causes of cerebral palsy. Okay, the first cause is traumatic head injury to an infant, such motor accident, fall, or physical abuse. So this is normally a cerebral palsy is basically it's about the brain and its development on it. When your brain is injured due to accidents or you fall from anywhere when you are in your baby times, so your brain will be affected and it will cause cerebral palsy. The second one, infant infection, which will cause inflammation in or around the brain. So this is basically because when there is any virus attack, or normally when an infant is getting fever or what in their childhood times, maybe the virus is overly attacked and it will cause infection in brain, basically in all over the body, but mainly it will affect our brain. So this can cause cerebral palsy as well. On the other causes, the third cause, bleeding into brain of baby in the womb or as a newborn. This usually happens when the mother of the baby is injured or she got hit somewhere or what. So the accident which happened to her can affect the baby as well. So whatever accident that she goes through will the baby go through as well. So this will happen that the bleeding into the baby's brain, which will cause cerebral palsy, and it will stop the development of the brain of the baby. The last cause is gene mutation and result in genetic disorders or notice difference in brain development of a child or a baby. Um, Normally, cerebral palsy can also happen due to genetic disorder, due to our gene. If our grandparents, our great grandparents, if they had this disorder, it will follow us also. The gene will continue, and it can also happen to be a genetic disorder. So these are the causes of cerebral palsy. That's all from me. Thank you.
Thank you, Kritika, and I'm gonna explain and good evening, everyone. And I am Kuganan Balagan, and there's a several like symptoms of the and identify the symptom of the cerebral palsy. The first number one is called muscle tone, and number two is a movement coordination control, and number three is reflex, and number four is the oral motor function. So there is so many symptoms to find that identify the cerebral palsy. Next slide. Okay, I only choose the 4 point. My first point is about the muscle tone. The muscle tone is basically it's the person with the cerebral palsy we can call a hypertonia related to chronically constipated limb and become stiff and difficult to move. So their muscles they are like a cramp and they can't move. That's what called the muscle tone. Say like it will mostly affect the child and the kids and when they are studying. So the second one is the movement and coordination controls. The muscle tone, like hypertonia, the kids with the hypertonia, they can't move, they can't walk properly, they can't run probably because they have the hypertonia, like a cerebral palsy, they affect the brain, that the impulse that's sent to the brain by coordination. Combination of the multiple muscle control impairment cause the movement and coordination control child with the cerebral palsy and repulsive stretched and contract moving rhythmically and a time of jerking possibly. And the third one is next slide, please. And the third one is my reflexes. A combination of multiple muscles, a control impairment cause the movement and coordination control child with the cerebral palsy and repeatedly stretch and contracted movably and all-time jerking and spectally. So it's also related to the second point I mentioned it, because the reflexes they can't they can't react to the accident when they are first falling, when they go to falling into the bike when riding a bicycle accident, they can't react to the so fast as a normal human being they can, because the low impulse in the brain that affect the cerebral palsy. And the fourth one is oral motor function. The oral motor function we can say they can't the person with the kids or the person with the cerebral palsy, they can't speaking, swallowing, eating, and chewing or drawing or affect the cerebral palsy children because of combination of a damaged and developing brain. This may be the most difficult cerebral symptoms of the cerebral palsy. If the four symptoms are if the person they have 100%, we can call the person fully affected by the cerebral palsy. Thank you.
All right. As there are causes, there are all right. As there are causes, there are also risks. 5 of them would be birth complications, infections, blood type incompatibility, and jaundice, multiple births, and fetal growth restrictions. 5. The birth complications would result in birth complications one of the reasons of birth complications is of course, having the head damaged because of all right. One of the reasons of birth complications is because of having a head injury during inside of the womb, such as the brain, such as the brain during birth. It will have it will have trouble as it would result in the baby injured during birth. Infections, as it is, would also because of bleeding into the brain of the baby in the womb or as a newborn. One of the examples could be the baby having an infection right after birth because of having bleeding into the brain of a baby during before birth. Blood type incompatibility and jaundice. I don't know how to explain that. Having multiple births, one of the five risks is having multiple births is having multiple births. All right, so for multiple births, the risk of having cerebral palsy is high depending on how much children are being born. One of the examples is if a woman would give birth to two or more babies such as twins, triplets or more, it would have a higher risk of having cerebral palsy. Fetal growth restrictions. So for fetal growth restrictions is fetal growth restrictions. The condition would be all right. Fetal growth restrictions is one defined by an estimated fetal weight less than the 10th percentile, depending on the gestational age and prenatal ultrasound evaluation. It is associated with the number of short-term and long-term complications that severely impact the quality of life. Thank you.
Okay, Assalamu alaikum and good afternoon. My name is Muhammad Nafa Adim, and I will be presenting about the solutions to cerebral palsy. Now, before I start, I think it's important to note that none of these solutions actually permanently, solve cerebral palsy. These are only can really only improve the quality of life for those with cerebral palsy. Okay, so the first solution is therapy. An example of this is physical therapy. Physical therapy can improve the child's strength, motor development, and mobility. So basically, it'll help the child with cerebral palsy move a lot better. Because those with cerebral palsy, as you probably know, have issues with their motor functions. Next is speech language therapy. This helps overcome difficulties with speaking and makes their abilities to speak clear. So those with cerebral palsy actually have sometimes it's stuttering. Overall, it's quite just inconvenient, and it's not easy for those with cerebral palsy to speak.
Okay, for the next part, is mine. My name is Muhammad Najwan.
Note to self, we have 10 minutes left, so please be quick. Not the recording, but the Zoom meeting. We have 10 minutes left.
Okay. Wait.
You want me to do this? I can do this, and you can do it. I
Okay.
was supposed to do two first.
Education. Okay.
Okay, sorry about that. I will be talking about the solutions again, medications. So for medications, there are oral muscle relaxants. These oral muscle relaxants help relax the muscles of the children's mouth. That's pretty self-explanatory. And the next sort of medication are muscle and nerve injections. These injections help treat the tightening of a specific muscle because those with cerebral palsy always have sort of like tightened muscles. So these injections will help deal with those. Thank you. I'm done with my part. I'll pass it on to my friend Najwan.
Hello, guys. My name is Muhammad Najwan, and I'm going to talk about the continuation for the solution in cerebral palsy. Okay, for the last part is surgery. Surgery is like the one of the last solution. If the other two solution doesn't work, like therapy and medication. For the surgery part, we have the first way of surgery, and it is cutting of nerve fiber. In more severe case, surgeons might selectively cut the nerve that serves specific muscle through a procedure known as selective posterior rhizotomy. This relaxes the leg muscle and reduce pain. A side effect that may be caused by this surgery include numbness. Okay, for the second surgery, we have the orthopedic surgery, which are latent muscle or reposition tendon that have been shortened by fracture. Children with any deformities might require surgery on their bone or joint. And this correction lessen pain and improve mobility for children with cerebral palsy. Okay, that's all for me. Thank you.
So may I ask who is next?
Hello everyone,
All right,
my
we have
name is
Kathy.
Kathy and today I would like to share about child abuse cases in Malaysia. So I think all of you must know what is the definition of child abuse because previous group already mentioned it. So today I would like to share about why does child abuse happen. Okay, for me, in my opinion, the child abuse will not happen without reasons. So why the child abuse related with the cerebral palsy children? Because for the cerebral palsy children, they are not able to care about themselves. So the parents must should pay more attention or whatever money on their on the children that have cerebral palsy. So I think during the COVID-19, the child abuse will become more cases because of the unemployment, because the parents will lose their income and they will become more easy to be angry, and this is why they lack of emotional control. And also one of the reason why child abuse happen is maybe the parents was the drug addict, then they don't know how to control their emotional or their attitude, so they will try to abuse their children. And next, what is the impact of the child abuse? And also the victim of the child abuse is actually the children, right? So in the children have who facing the child abuse problem, they may have mental health disorder and also distrust to connect with adults, and also they will have learning disorder also. Yeah, that's all from me. Thank you.
Hello, my name is Alia, and I'm going to talk about how to prevent child abuse. Parents need to understand their children more and talk with them, and also practice emotional control. It would be best if the parents join like support programs to help them understand their children's needs and wants. Any suspected abuse should be reported, but it's much better if it's prevented completely. So if you have a loved one in the family or anyone you know, you need to take steps to prevent the abuse and never put complete blind trust in one person. Thank you.
All right. Thank you, everyone, for your cooperation. You may leave now, and thank you, sir, for bearing with us.
Thank you,